What is a rotator cuff tear and what should you do about it? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. And I provide education, information, and commentary on all sorts of sports and exercise, injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. One of the most common sort of misconceptions when it comes to shoulder injuries is the rotator cuff. So many people, if they have shoulder pain, especially adults, assume that just because they've heard the term, they must have a rotator cuff tear. But you ask them, they don't even know what the rotator cuff is. So let me try to clear this up. The rotator cuff muscles are a series of muscles that attach to your shoulder blade. 3 in the back of the shoulder blade, 1 in the front of your shoulder blade. And then they form tendons that run right under the tip of your shoulder to attach to the ball of the ball and socket joint. And those rotator cuff muscles and tendons sort of stabilize the ball within the socket while the bigger muscles move your arm up overhead and out away from your body and behind your back. You can have a traumatic injury of your rotator cuff. You see it in people in their, say, late 30s, maybe 40s, that have a shoulder dislocation. The ball pops out of the socket, which is not that common in that age group, but the force can actually tear 1 or more of those rotator cuff tendons. But typically this is an overuse injury over a long period of time. It a lot of times can be a sort of an age-related change where those tendons get more fragile and they just tear with no specific injury. If you, and this has been done multiple times, when people study cadavers, people that have died, basically a huge percentage of the population as they get older have rotator cuff tears. Maybe they didn't even know it. You know, in the 50s, people may have, I don't know the numbers, but 20–30% of people may have rotator cuff tears. And it goes up every decade. I think I've seen numbers as high as 70% of people in their 70s have rotator cuff tears. So it's more common as you get older. Now the symptoms with rotator cuff tears are pain, obviously, pain reaching up overhead or out away from your body or behind your back, but also weakness. And a lot of times the physical therapy, if you send somebody to work with a therapist, they can help with things like pain and maybe shoulder stiffness, but sometimes with a full thickness tear of the rotator cuff tendon, you can have weakness that's just not getting that much better. And that's why surgery is an option for a number of people with rotator cuff tears, especially what I said, full thickness tears, where it's the full thickness of the tendon that's torn, not a partial tear. Now, some even partial tears end up needing surgery. So the younger you are, the more active you are, probably the more likely non-surgical treatment's going to work and the more likely you need surgery. Surgery is usually not the first thing we try for people in their 60s and 70s, but if they're not getting better and they're really limited by the pain or the weakness, surgery is an option. Fortunately, surgery today can almost always be done arthroscopically through a few little poke holes to the shoulder instead of a big long incision on the side of your shoulder. But it's still a major surgery with a very, very long recovery. If you think you have a rotator cuff tear and want to make the diagnosis and find out what your options are, you should consider talking to your doctor, or better yet, an orthopedic surgeon that deals with these problems to find out what's going on and what you could do next. Now, do you have a rotator cuff tear, and how did you get it? How did you find out you had it, and what did you do to treat it? I'd love to hear your experience, and I bet viewers all around the world would love to hear it as well. So below this video, share your experience and your thoughts and how it went. I'd love to read it, and again, I think people all around the world would love to read and learn from your experience. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my YouTube channel. I record a couple of these videos every single week and they'll get delivered directly to you. Thank you so much for watching. If you know people dealing with a rotator cuff tear, please share this video with them so hopefully they can learn a little bit more about what they may be dealing with. Thank you so much for watching, and I look forward to seeing you right here next time.